Trauma from accident and emergency cases is one of the top 10 causes of death here. The Health Ministry revealed this at a conference for A&E doctors. The Singapore Trauma and Acute Care Conference, or the STACC, wants to help experts share best practices. For more, we speak next to Adjunct Associate Professor Li-Tserng. He's head of Trauma Centre at Tan Tock Seng Hospital. Thanks for coming this evening, Professor.
Thank you for having me.
Now, when we talk about trauma for the lay person, we think of what we see on television shows. I'm not that familiar with these in Grey's Anatomy or ER, but I expect many people are. I'm sure you know about them. Do they reflect what you really know about trauma care?
Well, it's a bit over-dramatization of what's happening in the emergency department, right? But as a trauma team leader, when we go down for the emergencies, right, things are a bit of what we call a controlled chaos. Yes, there's a lot of stuff going on at the same time, but we do have the pulse on stuff, and we do control the situation quite well, right? Probably the current viewers will be more attuned to those K-dramas, right, like Dr. Romantic. But nonetheless, it's not that dramatic. Right?
You're a lot younger than George Clooney at any rate, so let's forget about that one, those comparisons, Prof. Teo. Seriously now, let's look at some of the data, because 2% of all deaths here in Singapore is because of trauma cases. So there is a serious side to this. What does that mean when we look at our numbers in Singapore compared to those internationally?
So if we put it into perspective, right, 2% looks really small. But in actual fact, if you look at it, it's probably the 6th most common cause of death in Singapore, right? And if you stratify that to those below the age of 65, now that really moves it up, right? And if worldwide, right, the most common cause of death, if you put all forms of trauma together, including homicides, burns, and causes of death, trauma itself is the 5th most common cause of death worldwide, according to UN data 2019, right? So it is indeed something that afflicts the population and does not respect any particular age group, right? So that is something that we would like to highlight.
Right. Or if you could explain it to someone who may not get the technicalities of medical terms. Trauma, online I'm seeing a tissue injury that occurs more or less suddenly due to violence or accident. Again, explain that in succinctly for a layperson and also in TTSH. What sort of patterns do you see in terms of trauma incidents in Singapore?
So a traumatic incident is essentially something that happened that was, number one, unexpected, and it caused injury to the individual, right? It can be head trauma or any form of injury, right? Okay. But in Tan Tock Seng, right, because we are the anchor trauma center of the central region of Singapore, right, we do see more severe trauma cases, and we are prepared to manage these trauma cases. And these consist of falls from height, road traffic accidents, or non-accidental injuries like stabbings.
Prof. Teo, what advice can you share to our viewers about avoiding such accidents? I mean, a lot of them happen at home as well. Yes, indeed.
So most of the trauma, to a certain extent, are preventable, right? Especially like at home, where if you have burns, you tend to get burns and scars when people don't handle hot liquids properly, right? Or if the furniture is in the way of the elderly, who may end up shuffling or be less comfortable with where they are walking, they may actually fall and get rib fractures. And outside of the home, simple things that we take for granted on a daily basis, like strapping up with our seatbelts, right? If we don't, we are likely to have severe trauma. And if we survive, even if we survive not wearing a seatbelt, we may end up having very bad injuries that will end up leading us to have a lot of disabilities or a long hospital stay. Yeah.
All right. We can take our own precautions so we minimize the chances of any traumatic injury. But should they happen, what plans are in place in Singapore to ensure that whoever is injured gets care as quickly as possible?
So we do need to moderate that a bit. Quickly and right sighting of the patient is very important. So in Singapore, we've embarked on a program where we designate anchor hospitals in a geographically determined area such that our severely injured trauma patients can reach an anchor trauma center in the shortest time possible. Now, if a patient is in extremis or is very critical, right, the paramedic services will still bring them to a capable hospital that is nearest and shortest time to receive immediate medical care, for which after that, once they're a bit more stabilized, they can be moved to an anchor trauma hospital.
Speed is of the essence when dealing with cases like this, of course. Prof Teo, before you leave us, can you tell us more about this conference? We mentioned it earlier, the Singapore Trauma and Acute Care Conference that wants to help experts share best practices. What's your goal for this?
So our goal for this is essentially bringing, right, to Singapore the best minds and thought leaders in trauma care, not just at the ER, but in orthopedics, general surgery, neurosurgery, all to one spot in Singapore, and use it as a platform for which we can share ideas not just for overseas, but allow Singapore doctors to share their expertise, cross-collaborate, and also have new ideas on research such that we can improve trauma care in Singapore and Asia.
Oh, thanks so much for joining us this evening. Adjunct Associate Professor Li-Tserng from Tan Tock Seng Hospital.
Thank you.